Good evening, everyone present here, and I welcome on today's KK's Med Talks Discover, Learn and Discuss. मैं आपका होस्ट फराज आप सभी लोगों का स्वागत करता हूं आज के इंसाइटफुल सेशन में। और जैसे आज हमारा बहुत ही इम्पोर्टेंट रेवेलेंट टॉपिक है और आजकल हमारे आसपास में ये चीज़ें काफ़ी देखी जाती है, जहाँ पर सोशल मीडिया यूज़ करते हैं लाइफ में, रील्स में, या फिर बहुत जगह ऐसे वीडियोज़ आते हैं न्यूज़ चैनल में भी। तो आप सभी लोगों को मैं बता देता हूँ कि व्हाट इज़ द टॉपिक फॉर आवर टुडेज, दैट इज़ यंग हार्ट अटैक्स, व्हाई दे आर इंक्रीजिंग। कम एज में, कम उम्र में हार्ट अटैक के प्रॉब्लम्स क्यों देखे जा रहे हैं। तो आज हम देख रहे हैं कि हार्ट अटैक जो पहले 50-60 साल की कॉमन एज में होता था, अब 30 से 40 साल के यंग लोगों में भी बढ़ता जा रहा है। ये एक सीरियस हेल्थ कंसर्न बन चुका है। तो आज का जो सेशन है हम इसमें जानेंगे कि यंग लोगों में हार्ट अटैक के मेजर रिस्क फैक्टर क्या हैं, लाइफस्टाइल और हेल्थ के क्या इम्पैक्ट पड़ता है, और कौन से अर्ली साइंस एंड जो इग्नोर नहीं करना चाहिए, और हम अपने प्रिवेंटिव के लिए क्या क्या चीज़ें कर सकते हैं। तो as we know that the topic is very much important, so we need someone who is expert. So without very further delay, I would like to invite our guest, none other than Dr. Chandrakant Patil sir. Sir, it is great honor to have you on today's discussion. And let me share some of the achievement of sir. Sir is highly respected and experienced cardiologist, and he is interventional cardiologist with decades of clinical experience, WHO fellow in interventional cardiologist from USA, and visiting cardiologist at Sri Shankara Cancer Hospital and Research Center, Bangalore, and he is teaching faculty at Manipal Hospital, Bangalore, and he has contributed extensively to cardiology practice and academic teaching. So, without any further delay, I would like to start this talk show. सर बहुत बहुत स्वागत
Thank
है
you.
सर आपके इस टॉक शो में।
Thank you very much.
सर लाइक हमने टॉपिक के बारे में बताया सभी लोगों को, लाइक यंग एज में बहुत सारे लोग फिट भी होते हैं, उसके बाद भी हार्ट अटैक्स की चीज़ें इंक्रीज कर रही हैं। तो लाइक सर सबसे पहले तो व्हाट इज़ दी हार्ट अटैक इन लेमन लैंग्वेज में, हार्ट अटैक क्या होता है सर, उसके ऊपर कुछ पॉइंट्स आप सभी ऑडियंस को बता दीजिए।
हमारे हार्ट को 3 ब्लड वेसल्स बोलते हैं ना, उससे खून मिलता है वो अपने एक्शन के लिए। सो देयर आर 3 coronary arteries which normally carry blood to the heart for its normal working, because it almost has to pump lakh times per day. In that way, it's very, very important for its own food also should be supplied through these arteries. And whenever there is a fat deposition inside these arteries, and once the lot of we call it the atherosclerotic plaque rather. So when that atherosclerotic plaque, sometimes because of its inflammation inside of that artery, it can rupture. And once there is a rupture, there is a complete blockage because of the clot formation. Once there is a blockage, naturally a part of the heart muscle gets damaged because it is not getting its own blood supply to work properly, and that is what is called as a heart attack. If it is a partial blockage, it's called as a non-ST elevation myocardial infarction or unstable angina. Whereas if it is a complete blockage, we call it as a heart attack. That's what is a meaning of the myocardial infarction. Because heart muscle, if it doesn't get its own blood supply within minutes of its blockage, then it undergoes necrosis from inside layer to the outside. Well, that is called as what is called as a infarction. Okay, heart attack.
Thank you so much, sir. आपने you have explained in very simple language. I hope that all the audience who have joined this live talk show will be getting lots of knowledge on from these things. Sir, I can see like few comments. Like Mithun has written nice, and Dr. Surender has written that thank you for taking this important topic. So जैसा कि हम सभी लोग जानते हैं, like we used to do research things by our own. बट ये जो हमारा टॉक शो है, इट इज गोइंग टू गिव अ नॉलेज फ्रॉम आवर एक्सपर्ट डॉक्टर्स, वो काफ़ी हेल्पफुल होगा लाइक आई थिंक। तो सर मैं अगला सवाल आपसे क्वेश्चंस लेना चाहूँगा। नेक्स्ट क्वेश्चन इज वेरी इंपॉर्टेंट आई थिंक सर, जैसे कि हमारा टॉपिक ही है कि लाइक पीपल आर गेटिंग हार्ट अटैक्स इन यंग एज, तो सर व्हाई हार्ट अटैक्स इंक्रीजिंग इन पीपल अंडर 40 एजेस सर, व्हाट कैन बी द रीजन सर?
In Indian literature, as we have seen, these coronary arteries are becoming very common, and below the age of 50 years, almost 50% of the people are dying due to this coronary artery disease. That's why its importance. We call young heart attack because below the age of 40 years, almost 25% of the heart attacks are occurring. That's what is the importance of, because this is the age wherein we are very active, we are earning, we are leading our family life, and all these are very very important. And that is the in this age itself, and such a disaster occurs, naturally it leads to health problems, and in a long term it affects his family in turn also, as well as it leads to later heart failure, recurrent attacks, all these things. That's why it is important.
Thank you so much, sir, for explaining this question in very well and very informative way, sir. I again hope this will be going to help all the participants, sir. Moving forward, sir, very important question. As we know that, sir, like we compare with others, right, sir, and we take see that in Western countries, people get heart attacks in like more ages when they become old. And then my next question is related to that only, sir. Why that Indians develop heart disease 8 to 10 years earlier than the Western population, sir? What can be the reason, sir, for that?
Yeah. Mainly, it is a South Asians have got a more of a genetic trend. Along with this, of course, our own lifestyle, what we are keeping day to day, that is also equally important. For example, this obesity is becoming a like a pandemic, and obesity includes so many factors because we are eating more, we are working less, rather walking less. In that way, the bad lifestyle and the stress what day to day we are facing, whether it's a work life or a family life or whatever it is, so that stress also leads to lot of this thing. And associated, air pollution, inflammation, all the cities are rather have a lot of air pollution nowadays, that air quality index we call, that is also every day. In Bangalore it is little better, whereas the, Mumbai and Delhi, the air quality itself is very bad. Even that is also supposed to increase the heart attacks. So stress, our bad lifestyle, obesity, and the increasing trend for blood pressure, diabetes, and especially the smoking. Young people are very much, I don't know, because of the stress or whatever it is, they are smoking very much, even though they are studying in schools that it's very bad and we have to stop. But still, many are doing that, whether to relieve their own stress. I don't know the reason at all. So these are all the factors why these heart attacks are becoming more common. And what I told you, genetic trend itself is more in Indians. We call this LPA. LPA is generally in present in almost 25%. LPA is nothing but a bad cholesterol we call, and that is very much predominant in Indians. In that is also an added main contributing factor. Thank you.
Thank you so much, sir. आपने ये questions you have explained really well, sir, and I think this is very much important. Like, what is the difference between us and the Western culture? ये काफी impactful होता है, sir. Like we used to follow, like Western culture के बहुत सारे चीजों तो हम लोग follow करते हैं, but we don't follow what is good for us. The healthy things we don't prefer, right, sir? तो आपने जो चीजें बताई, sir, the role of diet, lifestyle play a very major impact. और सर एक काफी important risk factor भी आपने discuss किया, that is obesity. I think that people don't give priority to the health. They give priority to everything in our country, but they don't focus on the health, right, sir? So I hope, sir,
Yes.
this will be going to create awareness between them and try to make them more informative about their health and try to overcome these problems. Moving forward, sir, एक question आ रहा है, sir. Like विनीता जी पूछ रही हैं, like her age is 37-year-old and she is female, and her triglyceride level is 333 and her HDL is 45. Sir, क्या ये dangerous है या ये safe zone में है, sir?
Definitely, it is a little risky because triglycerides, as such, anything over 150 milligrams we call in a fasting level. After food, if it is more than 175, is one of the risk factors. Not that, and of course, her HDL should have been more than 50 milligrams. Her it is 33 milligrams. both together is like a risk factor for future heart attacks. So that we have to see what is she having any diabetes, like thyroid disorders, is she obese, because and her own lifestyle, all these are very important. We have to check for all these things, insulin resistance, like pre-diabetes, diabetes, all these things, and her own lifestyle she has to improve. And of course, if there is a non-vegetarian eating, that also she has to change completely to a vegetarian diet. All these things are very much, activity is very very important. 45
Yes,
minutes
sir.
of walking every day. Yeah. Thank you.
Yes, sir. Thank you so much, sir. I hope that Vinita ma'am has received her answer and she will work on that. अगर कभी next time हम ये session करेंगे, like come with another topic, and she will give a positive feedback that now she is getting better. And sir, like thank you so much for responding to her queries. Moving forward, sir, एक काफी important question आता है, sir. Like you have discussed about one risk factor, that is obesity, right, sir? And what can be the other more risk factor to heart failure, sir? What heart attack, sir? Can you please point some more factors?
And definitely. Apart from obesity, obesity itself contains almost five factors. What is that? Is one is a there can be associated blood pressure, there can be associated insulin resistance or a diabetes. And then I told you the waistline itself is more than 90 centimeters in a male or an 80 centimeters in a female, and it's a inflammation itself. Obesity itself is an inflammation, and they've got a low HDL, just now we discussed, and high triglycerides. All these five factors together is a high risk for the future heart attacks. Apart from that, smoking is a very very important risk factor. Most of the young people, almost the major risk factor is a smoking, because smoking itself is an inflammation. It increases the fibrinogen, it increases the coagulation, clot formation also it hastens, and platelet reactivity we call. Platelets are the ones which block if there is any injury, they actually prevent the bleeding. So they, whenever they adhere to each other, that also can lead to clot formation and heart attack. So smoking, then alcohol itself doesn't end there, because it also increases the triglycerides. And apart from that, along with alcohol, people take a lot of saturated fats, all these things, and maybe the food itself is more consumed. So, and alcohol itself is a direct, but indirectly it is supposed to increase the risk of the heart attacks. Apart from that, genetic trend, I told you, if there's a father having a heart attack below the age of 55 years, a mother having a heart attack below the age of 65 years, if there's a family trend, definitely whole of the family members have to get checked themselves. Apart from that, I told you, diabetes, if it is there, it itself is equal to a heart disease risk, and they may be having a future, they have to get checked for their future heart attacks also. So these are all the various risk factors, and very important is a cholesterol. Especially I told you LDL cholesterol, which is a bad cholesterol. HDL
Yes.
cholesterol is a good cholesterol. Less than 40 in a male, less than 50 in a female is again a risk factor for a heart attacks.
Thank you so much, sir. You have explained very important risk factors. As we know that, like the young people are coming and doing the smoking, having alcohols, and not following the proper lifestyle, sir, and which is increasing, and you eating junk foods and having like high cholesterol foods, sir, and which is resulting on this kind of things. Sir, I hope that you have explained really well, and it is going to help all the participants on their like day-to-day lifestyle too, sir. Sir, moving forward, one very important question, like you have discussed about the risk factor, and it comes very important thing is lifestyle, role of lifestyle. Sir, what is the impact of people working in IT sectors, night shift, not having the proper sleep, and having lots of stress? What is the impact of lifestyle in the heart attack, sir? Can you please share some point on that?
I think the IT people, as you know, they are more goal oriented. They have to finish their projects on time, and that stress is always there. And stress itself is a big risk factor for the future heart attack. Apart from that, they're sitting continuously along with the computer or whatever they are working, and without much walking, all these things, that also adds to it. Is like a sedentary lifestyle. They are not at all active. So that is another thing. The third thing, shifts they are doing, sometimes night shifts, daytime shifts, all these things. And when normally we require at least 6 to 8 hours of sleep for our brain rest as well as the rest to the whole body. When we don't sleep, it itself is like an inflammation in the body. So that also adds to the risk. So all these factors, and I told you, many smoke because of the stress and other things. And maybe even they are exposed to the alcohol, and I told you saturated fats, all these things. So all these factors together, they are made to undergo this. They are at risk for the future heart attacks.
Thank you so much, sir, again for discussing these important points and highlighting the risk factor, that is red flags, we can say, like we need to follow and try to become as fit as we can. And Dr. Vinita has written, thank you so much, sir, for sharing my points and making like explaining the things I need to, and I will take precautions. And she has mentioned this thing. Moving forward, sir, I can see one more important question. As we see in the news channels and like on social media, like people who are doing gyms, right, sir, and going to cardio and taking care of their health, still they are also being surrounded by the heart attack, sir. What can be the reason, sir? Like, can you please share some point on that also, so that people can be aware and try to follow the healthy things?
Actually, the lifestyle, the routine walking, no, slow walk is also not good. Fast walk or running is also not that good. It is only the moderate intensity exercise we call. Many times these youngsters, they always have a running trend, all these things, and lifting heavy weights. That too, this lifting heavy weights itself is an isometric exercise that's hardly required 10 minutes per day or intermittently, not that it should be a continuous process. So these youngsters, I think they are making gym as a big exercise, but they are exposed to these things. Excessive work strain or whatever, weightlifting as well as running at a very high speed, all these are more dangerous. They are not that useful. For example, without checking, if they go on doing a gym, first of all, they should get checked themselves what risk factors they are having. If there are risk factors, they should have a treadmill test or any other test like calcium scoring we call. If nothing is there, then only they can go undergo the gym training, all these things. If already there are family histories there, they are smokers, they are exposed to the other risk factors, they are having blood pressure. So such things, when they are there, they should have a cardiologist opinion before doing these exercises. I told you, running is also not that good. Yet lifting heavy weight continuously is also not that good. And only it's a moderate intensity walking or an exercise is good. In between, you can have a isometric exercise, or especially the swimming, cycling, brisk walk. These are the best forms of exercises. Thank you.
Thank you so much, sir, for sharing some of the important points on that also. Like people going to gym and getting heart attack is a major concern, but following the gym's perspectives, the precautions are very important, sir. Like we should follow the things. Like कुछ भी चीजें, like if we do some things about the beyond, मतलब हमारे जो limit से चीजें जो बाहर हैं, if we do this kind of things, it will result in adverse condition, right, sir?
Yes.
Thank you, sir, for
Yes.
sharing this important point. Moving forward, sir, एक काफी important question आ रहा है. Like heart attacks come with symptoms, right, sir? So what can be
Yes.
the symptom? क्या वुमेन और मेन में दोनों में अलग अलग कुछ अंतर है, डिफरेंट है इन द सिम्टम्स, सर? कैन यू प्लीज शेयर सम पॉइंट ऑन दैट, सर?
Yeah, definitely, definitely. The young people, most often they have a, whenever a heart attack occurs, most often it is a chest discomfort or a chest pain, which is most often center of the chest, and it is a vague pain. It is not at particularly at one point, and usually it remains for few minutes. And most often it is like a gripping pain, or a catching pain, or as if a heavy weight has been kept on the chest, and usually it radiates to the left arm, maybe even to the right arm, or to the neck, or to the back, or to the epigastric region, or to the left arm like this. And most often it remains for more than few minutes, and often related either to the emotional stress or to an exercise. Following that, usually they get or so. And whenever this pain remains for more than 20 minutes, along with nausea, vomiting, weakness, sweating, we have to check ourselves that is there any heart attack, and immediately an ECG is required just to rule out whether there are ECG changes which are suggestive of a heart attack. We call myocardial infarction in a medical terms. And
Thank you so
sometimes
much.
in
Yes,
women, just a minute, in women, all these typical symptoms may not occur. They can have a breathlessness, they can have a giddiness, they can have a back pain, or they can have a palpitations. So women sometimes may not have the typical chest pain. They can have in other forms like giddiness, weakness, nausea, vomiting, palpitations. These are, but chest pain is the major symptom. Them also young people, but definitely there are atypical symptoms are more common in women compared to the men. And of course, other symptoms I told you, sometimes breathlessness can be there can be sweating, vomiting, giddiness, all these things are there along with a heart attack.
again, thank you so much, sir, for sharing these important symptoms and differentiating between men and women. That is more important. Like though both have their different symptoms. Sir, एक काफी important question में है, sir. I will take this question, sir. As we know that, sir,
Yes.
हमारे जो surrounding है, हमारे जो society में, sir, एक चीज बहुत common देखा जाता है. Like कोई भी चीज का problem होता है, if there is any kind of problem, they ignore it and try to give some silly reasons. तो सर एक काफी इंपॉर्टेंट चीज देखा गया इन कंसर्न ऑफ हार्ट अटैक. लाइक किसी भी तरह का चेस्ट पेन होता है तो लाइक पीपल से दैट इट इज ड्यू टू एसिडिटी, गैस के कारण से हो रहा है. लाइक तो सर इसको कितना सीरियस लिया जाए और किस क्या एक्शन लेना चाहिए उस टाइम में?
Most often amongst the chest pain, 5 to 10% are due to the heart problems. There can be other problems also like acidity problems, gastric problems are also there. Sometimes even heart pain can also mimic like a gastric pain because heartburn we call wherever there is a burning sensation retrosternally. But most often it is related to the food following meal, everything. If then there can be a acidity problems, all these things, and which can remain for almost a half an hour to 1 hour like that. Whereas a heart attack usually it remains in few minutes, and if it is more than 20 minutes, probably this person starts sweating, vomiting. He has other associated symptoms also. But at the same time, you should never neglect, even if it is an acidity, get an ECG done and rule out a myocardial infarction, which is more major risk factor for deaths and other heart failure, all these things. That's why we must rule out, even though if there is a suspicion, better get an immediate opinion, get an ECG done. And even if one ECG is normal, you may have to wait for another ECG after half an hour or 1 hour just to rule out and wait for the doctor's opinion. We also do what is called as a troponin T enzymes, high sensitivity troponin, which can rule in and rule out if we repeat at immediately as well as 1 hour and 3 hours later. If there is no rise in the enzyme, probably that indicates that there is no heart attack. If there is any rise in the enzyme also along with ECG changes, that itself indicates an heart attack, and immediately you have to undertake a angiogram and a cardiology opinion, all these things. Thank you.
Thank you so much, sir, for explaining this major concern, sir. I hope, sir, these points will be very much helpful once again. I can see one greetings from Mr. Shakti, and he's telling good evening, sir, and very informative session. Thanks, doctor.
Thank,
Like we are
thank you.
receiving lots of feedbacks from the participant too, as we are discussing a very key important topic. And I can see Arpita Bose is also writing very informative. Like people are really liking this topic, and they're sharing their opinion and feedback too. Like moving
Thank you.
forward, sir, I would like to take another question thing. I think it is very important, sir. We take things like this, we take it serious, like we do the testings, but very important thing is miss out, sir. We don't have much knowledge about the cholesterol, right, sir? How important is cholesterol screening before the age of 30?
Definitely, I think usually at college going age, we must get our cholesterol checked up. If the total cholesterol is more than 200 milligrams, we call. If the LDL cholesterol is more than 130, 180 is the cutoff. If any LDL is more than 180, they need the treatment rather. Because if the LDL is remaining high for many, many years, that's how the plaque buildup occurs in the blood vessels of the heart. That's called, I told you, atherosclerotic cardiovascular disease, we call. LDL can be there not only in the heart vessels, it can be there in the neck vessels, that's called as carotid vessels, we call, which supply to the brain, and also the limb vessels, we call femoral arteries and its branches. There also it can build up. That's why for all these vascular problems, whether it's a heart attack, whether it's a stroke, or for a peripheral arterial disease, this LDL is very, very important. I told you the cutoff is 180, and never wait for that. Always, if it is more than 100, we have to aim to control that LDL. And if it is less than 70, the chances of getting heart attack are less. Apart from LDL, there are other bad cholesterol. I told you genetic trend in the form of an LPA. If the LPA is more than 50 milligrams, we should be very careful, and we have to adopt a good lifestyle, because LPA is only once we in a lifetime we have to check. It's not regularly. Whereas LDL varies with our lifestyle, varies with our diet, exercise, and definitely if it is more, we have to have a repeated checkup every 3 to 6 months. And I told you, see that your LDL is kept below 70, and triglycerides we have already discussed. More than 150 is also a risk factor. Then actually we call non-HDL cholesterol, which contain all other lipid containing what we call chylomicrons, all these things which are called a remnant cholesterol, which is very important for the plaque buildup. So all these are very important, and ApoB, if it is more than 130, again that indicates that it's a high risk only. So we have to check all these parameters, whether it's on empty stomach or even following a food also. Both are required.
Yes, sir.
Thank you.
Thank you so much, sir. I can see, sir, Mr. Basavaraj sir has also joined, and he has sent the greetings. Thanks a lot, Dr. Patil sir. And he has
Thank
written one of the comment, and one more like feedback from Flora for her, and she has written informative session. I hope, sir, they all are using like really enjoying this talk show. Moving forward, sir, I will take a very important term, that is, what is lipoprotein and what young Indians should get it tested, sir. What's your point of
Yeah.
view on that, sir?
Lipoproteins are the proteins which carry these lipid particles. They are called as lipoproteins. I told you lipoprotein A. What is lipoprotein A is nothing but a LDL with an apolipoprotein A. In that way, it carries that LDL. So it's again a bad particle which is genetically determined. So if the LPA levels are, the cutoff is usually 50 milligrams. If it is more than 50 milligrams, we are genetically at a high risk for a future heart attacks. That's why I told you, in anybody's lifetime after the age of 2 years, once the LPA gets stabilized, if we check our LPA levels, if it is more than 50 milligram, we are at a greater risk for a future heart attacks, and we should get checked up. Of course, other lipoproteins in general, they carry this HDL, LDL, all these chylomec, all these things are carried with the lipoproteins itself. What is more important is an LPA. LP little a we call it as. Okay? That is genetically determined.
Yes, sir.
And once in a lifetime, you have to get it checked. Thank you.
Thank you so much, sir, for telling all the audience about that term. I hope, sir, they will be informative. सर, एक जैसे कहावत है, सर, एक प्रिवेंशन इज बेटर देन क्योर. अगर कोई प्रॉब्लम समस्या आ रहा है तो उससे बचाव करो, इससे पहले वो बड़ा बीमारी या बिग डिजीज में कन्वर्ट हो जाए। तो सर एक काफी लास्ट क्वेश्चन आपसे मैं पूछना चाहूंगा। दिस इज सर, व्हाट प्रिवेंटिव हार्ट चेकअप शुड यंग अडल्ट्स अंडरगो एंड हाउ ऑफन? क्या क्या चेकअप्स कराने
Yes,
चाहिए कम एज में, और कितने कितने गैप में और इंटरवल में कराना चाहिए सर, टू चेक दैट
yes.
माय हेल्थ
Usually,
हार्ट इज परफॉर्मिंग वेल?
if there is a family history of heart attack, already father having a heart attack, mother, I told you below the age of 55 years, mother having a heart attack below the age of 65 years, our brothers, that is we call first generation. If anybody in the first generation are already having a heart attack, the whole family has to be checked regarding their cholesterol. Of course, I told you blood pressure, the sugar content, and I told you keep up your belly, that is a waistline, below 90 in a male, below 80 in a female. And if such a thing is there, and if the cholesterol levels are high, definitely they all need the treatment itself, because there's a genetic trend already in that family of having a heart attack. And definitely they have to adopt a very good lifestyle. They should stop smoking. They should eat less of a saturated fat, more vegetarian diet. They should walk regularly, at least 45 minutes of a moderate intensity walk, otherwise called as brisk walk. No need for this thing. And occasional, I told you, isometric exercise, lifting 10 minutes of a heavy, like lifting heavy weight, or cycling or swimming. These exercises are much better. So avoid the non-vegetarian food as far as possible. The If you are eating egg, avoid the yellow portion of the egg. White you can eat definitely, and vegetarian diet is the best in whole of this thing. And with a good lifestyle, stress-free life, a good sleep, and all these things are very very important. Avoid the habits. That's another advice I can give.
Thank you so much, sir, for sharing some precious points of taking healthy care of the healthy heart, sir. Sir, one like we will go, we are at the end of this session. We have already crossed the time limit, sir. One last, sir. You being a cardiologist, you see the patients on OPD, sir. What will be
Yes.
your like short take home message and pointers you want to share with young India, young generation to be aware for healthy heart, sir? What will be your take home message for them?
I think I advise my colleagues as well as the young people to adopt a good lifestyle, stress free life as far as possible. Not that stress is everywhere, rather, but as far as possible, try to have a stress free life, adopt meditation, yoga. I told you walking is a must, and I told you not to put on weight, and get yourself checked regularly, especially after the age of 20 years. And if it is already a family history, even before that itself, you have to have a checkup. Avoid smoking, avoid alcohol as far as possible, and I told you, sleep well, at least 6 to 8 hours a day. And these are all the advice. And if you are having this thing, I told you, even meditation, 10 to 15 minutes a day is also equally good to keep yourself mentally and physically healthy. So these are all the advice I can give.
Thank you so much, sir, for taking out your important time and sharing this important session on an important topic, sir, our talk show. Sir, with this, sir, I would like to thanks for such an insightful and informative session, sir, on young heart attacks and why they are increasing. Your valuable insight on risk factors, early warning signs, and preventive strategies will surely help our audience to become more aware and proactive about their heart health. Sir, with this, I would like to extend my sincere thanks to all our participants for joining us today and being such a wonderful audience. We hope this session have been informative and useful in understanding how important it to take care of our heart, especially at young age. On this, on behalf of Dr. KK's Med Talks, I would like to thanks all the participants for their valuable time. And Dr. KK's Med Talks will return with on Monday with another edition with another talk with Dr. Sanjay Karla, sir. Till then, stay healthy, stay aware, and take good care of your heart. Good
Thank you.
evening and have a great weekend ahead. Thank you so much, sir.
Thank you. Thank you. Thank you.
टेक केयर सर.
थैंक यू.